Hello, I'm Dr. Kishore Kumar, Senior Neonatologist at Cloudnine Group of Hospitals and also the Founder Chairman of Cloudnine Group of Hospitals. I'm more of a perinatologist because I'm interested in antenatal care of babies in the pregnant mothers. Before I talk about the myths of pregnancy, I want to tell you pregnancy is all about wellness. Unlike any other medical condition, pregnancy is not an illness, but you still go to the doctor to make sure that you remain well. So, if pregnancy is wellness, why do you go to the hospital and lie in next to a person who is having chemotherapy for cancer or a fracture orthopedic patient or some renal failure patient? So that was the concept behind starting Cloudnine, where we wanted to have a mother celebrating the childbirth and enjoy the happiness. When we started, we realized that a lot of mothers have a lot of myths about their pregnancy. The commonest myth is when you become pregnant, you need to eat for two, and people start stuffing themselves. When you start stuffing yourself, you put on extra weight, and when you put on extra weight, then you have a risk of developing gestational diabetes in pregnancy. Gestational diabetes in pregnancy happens in pregnant women because of unhealthy eating and also eating too much of carbs or carbohydrates we call. So you need to eat healthy, you need to eat protein foods and not just eat for two, which means that eating too much of sugar. Similarly, there are lots of myths. One of the commonest myths in India is if you take iron, you will have a black baby. Now, there is no truth in it. A lot of mothers in India are anemic. So, if you are anemic, naturally your babies will be pale. If you do take iron, then the babies will be pinker, not black. And iron definitely doesn't cause blackness. There is one other myth in Indian women which says that if you take saffron during pregnancy, you will have a white baby. Now, saffron is one of the things which a lot of mothers take and there are no side effects, and that's why there is a myth which is continuing. Now, I have had a lot of parents who are Sri Lankan friends in Australia, and I used to see a lot of Sri Lankans have the same myth as Indians, and they used to take saffron. Honestly, I have never seen a fair complexioned Sri Lankan baby. So in other words, saffron does not cause you to have a white baby. What does cause you to have a white baby is a white partner. So you need to take saffron, but don't expect a white baby if you have dark parents. That is not going to happen. Pregnant women should take bed rest. Used to be the myth in the past, but now a lot of pregnant women are working, so naturally that myth has gone out of the window. A lot of people think about papaya and pineapple causing miscarriages. If you look at the world, definitely papaya and pineapple does not cause miscarriage, and a lot of countries those are the staple diet, and definitely Papua New Guinea is one of the best examples in the world where papaya and pineapple are staple diets and they have the lowest miscarriage rates. In other words, if you have always been eating papaya and pineapple and if you eat a slice of that, nothing will happen. But there's always a saying, too much of anything is too bad. So if you eat too much of papaya and pineapple, it may cause uterine contractions which may lead to miscarriage. So too much of anything can cause problems, not little if you have eaten once in a while. So these are the common myths in pregnancy which bothers Indian women, and certainly these are some of the examples which we talk in antenatal classes or what we call as a prenatal classes, and I'm sure you will benefit from attending these classes. Thank you.